Hi everyone, good evening. Dr. Rajarathna here. So we're going to start with the FundusWalk session. Please clarify for me if my voice is audible to all of you. Am I audible to you so that we can start the FundusWalk session? Because Sunday is Fundus Day and I hope things will be easy after we do this FundusWalk sessions. Am I audible, guys? If I'm audible, just let me know in the chat box so that we can start without... Yes? All right. Thank you, Shweta. All right. Good evening. Good evening, guys. Yes. Lovely. So we will start with the fundus images because, see, fundus image is part of your NEET PG questions, INI-CET, even FNG exams. Yes. So fundus is very, very relevant, and even for third MBBS, your final MBBS students, it's important because when you read, when you understand and learn, it makes a lot of difference. Yes. So today we are going to deal with central retinal vein occlusion, the same topic that I had put up on Instagram as a question for you today. So let's see the image that I had posted for you. So this is the image. Yes. So what are the findings that we see here? So this is the fundus image where you can see the optic disc here, although it's a little blurred, okay? But you can see the optic disc here and the vessels branching out. These are the temporal branches enclosing the macula. So as you see it, this is the left fundus because the optic disc is nasal. So you can see the macula temporal to the optic disc. Now, what are the findings I want you to note down? Now, very, very characteristic is this one that I've marked as number 1. So you can see these hemorrhages. Yes, can you see these flame-shaped hemorrhages? So these flame-shaped hemorrhages are there all over on all the 4 quadrants. Yes, so if I divide this fundus into 4, I see them on all the 4 quadrants. Yes, the splashed tomato, as if you splash tomato on this fundus. Yes, on this retina. And number 2, what I have marked as number 2, can you see these yellow, creamy, fluffy, cottony clouds? It looks like clouds, like cream colored clouds. So it looks actually like egg splash, splashed egg. So it's not just splashed tomato, it's also splashed egg. So both the tomatoes and the eggs are splashed all over the retina. Okay, so those are, number 2 is a cotton wool spot. Okay, so that is a cotton wool spot, and you can also see the retinal veins are dilated and tortuous, and the disc margins are a little blurred, so that means there is a disc edema. Yes, so this is central retinal vein occlusion. Now what I want you to remember when you look at an image is not just splashed tomato appearance. Yes, the MCQ. So the hemorrhage gives you the splashed tomato all over the retina. And also remember, like the egg, when you splash egg, your people are singing so horribly, or they are dancing so horribly. At least in government colleges, that is what used to happen in culturals. They throw all the rotten tomatoes and the rotten eggs. So just imagine that's all there, splashed all over the fundus. So when you see this splashed tomato appearance, yes, so that is central retinal vein occlusion. Now what are the other findings? No, I will teach you the other ones. Now this is another fundus picture to show you the splashed tomato appearance, again CRVO. Now what I want you to notice here is, can you see the hemorrhages all over the retina? And you can also see the cotton wool spots. Yes, and you can see very, very clearly the dilated and tortuous veins. What I marked as number 3. What I marked as number 1 is your hemorrhages, the red hemorrhages. Number 2 is your cotton wool spot. Number 3 is a dilated and tortuous retinal veins. And if you can see the disc here, this is the right fundus. So the optic disc is nasal, it is this side, the macula is temporal to the optic disc. The previous image was a left fundus, this is left fundus, okay, this is right fundus. Now you can see the nasal margins blurred. So when there is disc edema, initially earliest sign of disc edema is the blurring of the disc margin, and which margin blurs first? It's a nasal margin. Can you all appreciate all the 4 findings that I marked for you? So this is again central retinal vein occlusion, not a full-fledged, but yes, because I'm seeing the splash tomato and the splash tech all over the all the 4 quadrants. Yes? Is that clear? You'll not make a mistake in CRVO. Yes? So what are the risk factors for central retinal vein occlusion? Most important is your hypertension or atherosclerosis, also diabetes, and anything that contributes to Virchow's triad. So Virchow's triad is related to the pathophysiology of central retinal vein occlusion. What is Virchow's triad? What is Virchow's triad, guys? Please list out. That is not ophthalmology, so you should be able to easily say, although you might not fear ophthalmology now, but still, what are the components of Virchow's triad? So Virchow's triad is involved in the pathophysiology of central retinal vein occlusion. Virchow's triad: hypercoagulability, yes, endothelial injury, and venous stasis. So all the systemic conditions, n number of conditions like Waldenstrom's macroglobulinemia, multiple myeloma, then you got sickle cell retinopathy, yes, then protein C, protein S deficiency, Leiden 5 factor mutation, then you got this Apla syndrome, even obstructive sleep apnea, because obstructive sleep apnea, there is Virchow's triad in the pathophysiology, yes, in the underlying pathophysiology. So even obstructive sleep apnea is a risk factor for central retinal vein occlusion. Those of you all who joined in late, you can watch the video again, but again I'm telling you. So what I marked as number 1 are your red hemorrhages. Number 2 are the cotton wool spots, the cottony, creamy, cotton-like clouds. Yes, and you can see number 3, the dilated and tortuous veins and the disc edema. Yes, so when you see all these findings all over, then it is CRVO. Yes, exactly. OCP usage also, because it causes hypercoagulability. And coming to scrambled egg appearance that you asked, BU. Scrambled egg appearance is seen in Best's disease, Best's vitelliform macular dystrophy. We'll discuss it some other day. And what was the other thing that you had mentioned, Bita? One was scrambled egg appearance, and that is not CRVO. So CRVO appearance is splash tomato appearance, also described as blood and thunder appearance, central retinal vein occlusion. Is that clear? So go back to my Instagram post today and you can comment, right? So you will be able to diagnose this. So this is the right fundus showing you CRVO. This is the left fundus showing you the central retinal vein occlusion. This is more full-fledged. What was the other appearance you mentioned, BU? I said I'll talk about it in the end. Yeah, the ketchup, guys, see, look at this ketchup. See, splash tomato appearance is central retinal vein occlusion. Okay. The ketchup appearance, or what we call catsup, CATSUP, ketchup appearance or ketchup appearance, that is choroidal hemangioma. Okay, that's somewhere you can get caught, but till now they've not asked you that. Okay, so sauce and cheese appearance in CMV. Please remember, sauce and cheese appearance. It's not ketchup. We don't call it ketchup. Sauce and cheese appearance in cytomegalovirus chorioretinitis. Catsup or ketchup appearance, that is choroidal hemangioma. Okay, choroidal hemangioma. And this splash tomato appearance or blood and thunder appearance in central retinal vein occlusion. So 3 different terminologies, 3 different answers. Yes, scrambled egg plus ketchup line. Scrambled egg, pizza pie, see, CMV chorioretinitis can be described in 3 ways. One is pizza pie appearance, or sauce and cheese appearance, or your brush fire or bush fire appearance. Okay, those are for CMV chorioretinitis. Your scrambled egg appearance is for Best's disease, Best's vitelliform macular dystrophy. All right. And the catsup or ketchup on the retina, ketchup itself. See, you might ask, ma'am, what is the difference between sauce and ketchup? The published things. We're talking about what is in the literature. Catsup or ketchup on the retina is choroidal hemangioma. Is that clear to everyone? Okay. Any other questions? So CRVO in your brain box, you will not make a mistake. FMGs, it's important for FMG as well. Okay. So take a look. So you see the hemorrhages. So these are the flame-shaped hemorrhages. These are the cotton wool spots. So flame-shaped hemorrhages are located in which retinal layer? In the RNFL, retinal nerve fiber layer. And the cotton wool spots again are located in the RNFL. So both of them are in RNFL. The flame-shaped splinter hemorrhages and the cotton wool spots are located in the RNFL. And one more question for you. What is the most common cause of cotton wool spots? See, cotton wool spots is a non-specific sign. Okay. Whenever there is significant retinal ischemia. Yeah. So retinal ischemia will result in RNFL infarct, just like we get a myocardial infarct. Okay, heart is here. Oh, yeah. So this is my left side for you. It looks like a right side. Okay. So RNFL infarct is cotton wool spot, also known as erroneously a misnomer. It's also called a soft exudate. All right. So it is an RNFL infarct. So obviously it will be located in the RNFL. Ma'am, what is RNFL? Retinal nerve fiber layer. So you learned one more thing. The cotton wool spots and the splinter or the flame-shaped hemorrhages are also located in the RNFL. Is that clear? Yes. The most common cause of cotton wool spots, hypertensive retinopathy. Very good. Yes. Hypertensive retinopathy. It can be seen in diabetes. It can be seen in hypertensive retinopathy. It is also seen in HIV retinopathy. Yes. The most common cause is hypertensive retinopathy. And now another question. What is the most common manifestation of HIV retinopathy, cotton wool spots? Is that clear? HIV, because the HIV virus itself can go and clog and cause this kind of, it causes an embolus kind of thing, and it causes an infarct of the RNFL, causing cotton wool spots. So HIV retinopathy, most common ocular finding. HIV retinopathy, we're not talking about the ocular manifestations of HIV itself. In HIV retinopathy, what is the most common finding? It is cotton wool spot. Yes, very good, Priyanshu. Very good. All right. So I'll see you guys at 6 p.m. Images decoded. So we have the last week's images from my Instagram questions for us to decode. Yes. So let's do that at 6 p.m. All right. So see you guys at 6. Yes. Yes, Priyanshu. What is your question? Yes, beta. Hanji beta. Yeah. Yes, Krishna. It is hypertension, which is the most common cause of cotton wool spots. But although nowadays they don't ask such questions, but you should be able to, will you be able to identify cotton wool spots on the fundus? Yes, it will just look like clouds, okay? Cream colored clouds, like malai. Malai se agar aap cloud बनाओगे, बादल बनाओगे तो कैसे दिखेगा? ऐसे, okay? So these are cotton wool spots. Yes. Ill-defined, feathery margins. Priyanshu, I'm waiting for your question, beta. Beta, 4-dot test, I've already put up a video. At the end of this session, I will share the link of that video. Okay, I've explained it very, very clearly. Everything. Okay, I've put up images also and I've explained. Uska link मैं उसमें share कर देती हूँ. Okay, this is a purely FundusWalk session. All right. Okay, so I will see you guys at 6 p.m. ठीक है? चलो, bye bye. Where are my hearts? Where are my hearts? कोई हार्ट नहीं दे रहा है मुझे. देखो, ऐसे I have to ask. Anyway, bye guys. See you at 6.